Professor Julie Davies, and I'm the director of the MBA and EMBA health programs. And I will go through some slides, and you're very welcome to ask some questions at the end, or to put some comments in the Q&A or the chat. So I'll just bring up my slides so we can get started. Okay, so this is a 2-year program. It's 100% online and includes the option for you to come to the UK for 1 week in March of the first year, and to the US for 1 week in the following year. So it starts in September 2023, the end of September, with a residential school online. And then we have 4 blocks over several years. So what I'm going to do is give you an overview of University College London, then explain the Global Business School for Health. Then we'll look particularly at the role of MBAs, and specifically why the MBA and EMBA in health can give you a particular accelerated career option. We look at potential careers for you to continue or to pivot into. And then I'll present the details of the EMBA health program and the scholarships that we have available and upcoming events. So we are 8th in the world as a university, we're 4th in Europe, and we're very strong for medicine and life sciences, economics, education. So we have over 40,000 students annually joining University College London, and clearly that gives us many alumni networks around the world. So the university itself was founded almost 200 years ago as the first university in London that admitted women on the same basis as men and people from different religions. And the Global Business School for Health within this almost 200-year-old institution was started in a year ago, just over a year ago. So we're a startup in a very established, famous, research-intensive university. So we have not only a business school, but we have a school of dentistry, Eastman Dental Hospitals, and a medical school. So about 60% of our research activity is based on health, medicine, and life sciences. So UCL East is based in the Olympic Park in East London, and we offer a full range of graduate programs, including a PhD and a DBA in health. And we've just launched, we have the first cohort for the MBA full-time program and part-time program in London. We also have a suite of master's degrees. So we are the first business school in the world dedicated entirely to health. So most of our practitioners, academics, case studies, study visits are related to healthcare and the health industry. So our graduates are very much have an interdisciplinary focus. We have a quarter of the class who are not clinicians currently, and 3/4 who do have clinical backgrounds. So they're quite varied, but our key focus is on SDG, the Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. So clearly there's a huge demand for our graduates. There's a shortage of healthcare workers globally. Clearly the shift post-pandemic to telehealth, digital health, the cost of living crisis, the strain on healthcare systems and aging populations all increase the demand for executives who understand the business world as well as the healthcare sector. So here are some examples of current students. For example, Chong Sui has a PhD from Birmingham University. He's interested in building relationships between Asia and China in healthcare and translational work. So a little bit about ourselves. We're, as I said, completely dedicated to supporting the current and next generation of health management leaders. We are concerned with disruption and reimagining how health might look and health ecosystems. And we're looking at healthcare challenges from business and management perspectives and looking at health management as a public good. We have several GPs on our current program, including from the National Health Service. So Angel Gonzalez La Fuente is a family doctor from Spain who's already completed an MSc in public health and has some academic research and teaching experience. So as Kim Clark said, who was Dean formerly of Harvard Business School, medicine and business have been entwined for a very long time. And with emerging medical technology sweeping the delivery of healthcare and the desire to control costs of medications and healthcare interventions, there's a very solid need to have people with feet in both camps, the health field and also the management field. And it's a very complicated sector with at least 10% of GDP in many countries spent on health, possibly double that in the USA. We need specialists who are also generalists who have knowledge of the sector from a business angle. So the Executive MBA is designed to help you in your current employment. Many people will be continuing to work when they complete the EMBA, to give you options for moving into corporate suites on the board, work with strategy, working with entrepreneurs, other companies, partnerships, to give you the confidence to accelerate your career pathways and to develop new career opportunities and to take yourself to the next level of policy making and change. So you can continue to earn and learn at the same time. You have the flexibility. You develop very strongly. We're interested not only in developing your careers, but yourselves as individuals and professionals, and to develop kind of T-shaped professionals who have a breadth of knowledge as well as depth in the sector. And often this attracts people mid-career who've had maybe 5 to 10 years work experience. And what's great about UCL is that it's a fully comprehensive university. So it not only teaches STEM, but it teaches a complete range of subjects. So we think graduates will very much stand out from this program because of the expertise, the great networking we have through UCL and our alumni all over the world. So we'll be developing your networks as well as your expertise and your confidence, connections, and competence. So you each have a mentor from our range of health executives and residents who can support you with your careers. We have careers consultants also who can help you with your CVs if you're applying for management consulting, other jobs. And here are some of our current students on the current cohort. And what they really all have in common is ambition to make a difference. So they've come from various backgrounds such as clinicians, pharmaceuticals, management consulting, investment banking, marketing, research, but they're interested in accelerating their experiences, possibly working with management consulting firms or working in management consulting firms for a while, perhaps having hybrid roles, continuing to be clinicians, but also working with government. And you will be given the opportunity with 2 consulting projects to develop your consulting skills. So a little bit about the program itself. So it's designed very much with practitioners and academics. CEOs of hospitals, people who've worked in NGOs in the healthcare sector. So we kick off at the end of September. It's part-time. And as I said, you have these in-person programs if you wish. Tuition fee is $45,000 and there are scholarships available. So we realize that the medical curriculum often doesn't prepare people to understand health economics or healthcare systems or social science. So there are primer courses before you actually start the formal teaching blocks. There's an induction program, there's opportunities to take psychometric tests, to bond within the teams within your cohort, to find out more about yourselves. And then we have 4 blocks of teaching blocks. So the first block lasts for 8 weeks in the first term. So we focus on strategy, people, and marketing. So each of those for 2 weeks. And then we have a wrap-up week when we bring those 3 themes together and we look at the assessments. So assessment happens to be this year presentation to some members of Proximy, a Harvard business case, and a report. So when you finish that block, then you move on to another 8 weeks in the second term where you look at finance, economics, and data. Then in the second year, you look at executive leadership for 4 weeks and contemporary topics in health and healthcare in the teaching blocks. And then there are 2 projects that last the full 2 academic years, one of which is your individual consulting project, and the second is related to a group project. So we have the dates here for the 23-25 Executive MBA. So you can map out your time and you'll be having online tutorials at convenient times to suit your schedules. So the Global Health Research Project is a group project where you work in small groups on a particular issue. We're focusing particularly this year on NCDs and health ecosystems to solve real-world issues, so you gain management consulting skills within a group. The other one is the individual project, where you choose a project in consultation with us, either your own organization or another organization, where you work again on a health-related challenge in support with mentors and career coaches to make recommendations to your client to help solve that challenge. So clearly, Executive MBA, we're very interested in you as leaders and leadership in the plural. So clearly there are different models in different parts of the world. Here's an example of the NHS Leadership Academy on what they understand by leadership. We work very closely with UCLH NHS Foundation Trust. So David Probert is delivering some of our change management teaching. So you can see from his Twitter here, the focus on team building, on socialization, identity, performance management, excellent quality, and bringing in service users as part of healthcare in hospital management. So you may continue on your clinical career track. You may decide to go and work in a different sphere like management consulting, or the other way around, you're in management consulting generally and you want to work in the health sector. So there are a range of options open for you as part of this experience, and you'll build up CV enhancing outputs during the EMBA. So in terms of entry requirements, we're looking for an academic record that's equivalent of a 2-1 degree. If you don't have that, but you have an extensive executive or managerial leadership experience, that will equate to the academic requirement. We're looking for an IELTS score of 7 or above and no area less than 6.5 in the subcomponents. And that is a UCL requirement. There's no waiver for that, but you can take the GMAT, you can take the language tests multiple times. We expect you to have around 5 years work experience. We look for a well-balanced GMAT score. If you're a clinician, you may, on a case-by-case basis, request a waiver. And we interview everyone online for 20 minutes, myself and the deputy director of the EMBA program. And we also require a personal statement and 2 references. These are the links for the GMAT. Again, you can take them multiple times. And these are the kinds of questions we ask you at interview. So you want to know your career journey to date, which will help us make sense of your motivations and fit with the program, and help think about where you're heading. What is it particularly that motivates you to apply for an EMBA in the health arena? What makes you exceptional amongst the candidates? How you can contribute to the cohort and the camaraderie and the expertise within the cohort, your expectations, some evaluation of your own personal strengths and weaknesses, and where you might expect to be in 5 years' time. There is some scholarship funding available. So the earlier you apply, the earlier you can apply for the scholarships. And these are, we award scholarships of £15,000 split over the 2 years. And you need to convince us, how that will benefit and impact in your sector. There's also a range of very general scholarships available more widely, like the Chevening Scholarship, the Commonwealth, Fulbright, and so on. And there are specific UCL scholarships that you can apply for outside GBSH. We're very focused on supporting your careers. Only yesterday, we had someone from Deloitte who'd been a partner for 25 years, helping our students understand management consulting and supporting them with their CVs. So careers is throughout the program, career support. And clearly there's lots of activities at UCL and support for your well-being and advice, your members of the Students' Union. And if you would come to London as well, there are various clubs you can join. And when you come to London, it is a great city to visit and do activities. When you graduate from the EMBA, you might also be interested in pursuing a DBA in health. So here's some details of the 5-year Doctorate in Business Administration health program that we're launching currently, which also has taught courses at a doctoral level to help you prepare for your doctoral thesis. And we also run a whole range of executive education short courses that you might like to participate in, or when you graduate, you're very welcome to come back and keep in touch through some and update your skills, such as value-based healthcare, digital transformation. We have a whole series of webinars and in-person events. And then finally, just to wrap up, you may also be interested in the MBA health program, and that runs in 4-week blocks, and that's 4 weeks of 1 o'clock to 6 o'clock afternoons, part-time or full-time. There's on the 10th of November a scholarship and funding information session that you might like to join, Digital Health and Entrepreneurship Open Day on the 17th of November, and another Executive MBA Health Open Day on the 21st of November, and various events that you can participate in. So this is our first cohort. This is us at the residential school that we took for 3 days. And the EMBA very much also reflects our tried and tested curriculum on the current MBA program, with a much greater focus on leadership and the pedagogy of distance learning. Okay, so I see several of you have already put Q&A. Please feel free to post some questions. If you would like to get in touch with me too and have an informal chat, you can email me and we can arrange a time to have a conversation. So I'll stop the share now and look at some of your questions. So Zahir, IELTS is not required for native English speakers, so that's fine. If you've studied in the UK in the last few years, you don't need your IELTS. And then, yes, we do have people from the pharmaceutical industry on the MBA, and I imagine too on the EMBA. So it's about developing your skills in the healthcare sector generally, but we also do case studies from pharmaceutical business. And we have speakers, for example, we had Roche in today. We have a Roche scholarship for the MBA program. We have some of our healthcare executives in residence from Merck, from Roche. We had the chair of GSK giving a guest talk recently. So we certainly have people from the health sector who have a focus on pharma, and also we have students from the pharmaceutical sector too. Okay, so Jay, are you able to speak? You can if you wish.
Yeah. Hi there. Can you hear me?
Yes, we can, yeah.
Yeah, I've got two questions. So, first of all, to start with, I think this is a brilliant idea that you guys have come up with. I think I've personally looked out for something like this. So, good stuff. First question: you mentioned that the cost is 45K for the 2 years, right?
Yes.
And so obviously that is a big investment. And so how is the breakdown for, paying off that 45K? That is first question. Second question is, you've mentioned the doctorate there. And I've seen off the website that the doctorate is 5 years. So if one did the, the EMBA, which is 2 years, would that contribute to the 5 years, i.e., would the person then need 3 years, only another 3 years to complete the doctorate?
Yeah, unfortunately not. They're separate things. So yes, if you do want to do the DBA maybe, and you are eligible, maybe it would be quicker, as you suggest, to go straight to the DBA. No, there's no credits against one against the other, because one is a level 7 and the other's a level 8. So they are separate qualifications that you need to complete in their entirety. Yeah, in terms of the payments, clearly those can be spread out across the year. I don't think they're paid monthly. I think my understanding is they're paid termly. So you wouldn't have to pay, you certainly wouldn't pay 45 up front. You'd pay the first half in several installments.
Yeah, thank you.
Okay, thank you. As someone's asked, is the GMAT mandatory? You can request a GMAT waiver if you have a strong profile. Some clinicians have done lots of examinations and they can make a particular case perhaps that they would like to get a GMAT waiver. So that's an individual. And the GMAT scores, we don't specify GMAT scores. We say maybe around 600 or so, but we look at you in the round. The GMAT is not the deciding factor, and it's certainly not a deciding factor for the scholarship. The scholarship is based on what you think you are able to do with your qualification. So it's more about impact and how you're going to make a difference to other people's lives. So if you're currently working, Sylvia, in the NHS for a long time, I don't think you need an IELTS. And all you need to do for the GMAT waiver is send an email and request why you think you need a GMAT waiver. So we particularly if you do have a clinical background and you've had lots of exams in the past, you're more likely to get a GMAT waiver than someone who has not. If you only have an undergraduate degree, you're less likely, and you're not working in the sector as a clinician, it's less likely. There's no minimum nor maximum for the GMAT. So yes, someone's asked me about their particular score, you don't have to retake it. We like people to take the GMAT, but we're not very strict about what the score is. That isn't a game stopper, not a showstopper. So you don't have to pay for lots more tutoring and take the test again. Spend your time on thinking about your career journey and what you'd like to say in your application. So if you've already got your GMAT, well done. Don't worry about taking it again to get higher scores. Having a PhD, yes, that's very helpful already. So you've already studied at postgraduate level, certainly having a PhD already in whatever discipline. Okay, Gemma, I direct a portfolio of global city health programs at Healthy London Partnership. Okay, your question is, to what extent do the courses focus on integrated health and care? Yeah, so just a few minutes ago, we had Ned Naylor, who's a strategist in Health Education England. And clearly, we are interested in global health, not just the UK. but the fact that there's some very interesting things going on in the UK at the moment, integrating health and social care, that's certainly something that's very integral to our discussions. So obviously not all our cases are from the UK, they're from other parts of the world where health systems may be less integrated, but certainly a key theme is ecosystems. So how private organizations, different parts of health organizations work together. So for example, we just happen to be taking students to Saudi Arabia, Egypt, and India for the MBA. And our focus is very much on health ecosystems and how different bits of the ecosystem fit together and integrate. So yeah, that's very important. Okay, any more questions? If anyone would like to speak, raise your hand. Is that everything? So as I said, feel free to email me. Very happy to talk things through with you, how you might get support, get funding. We're very keen for, we've got a great geographical cohort. That's the great thing about UCL. Nahed, would you like to talk? You should be able to. Hi, we can hear you.
Yeah. Hi. So my question is actually about the structure of the program itself. So if we are to submit the applications, is there a deadline to submit the applications plus submit the like scholarship applications at the same time? And if so, when would we hear back about the acceptance or favorable
Outcome.
outcome, exactly?
Yeah, so we have several rounds this year. Last year it was like the end of June was the final submission of applications, by which time some people would have liked to have had scholarships, but we'd already given them out. So in a sense, the earlier you apply, the better. You have to upload your information first before you can apply for the scholarship. So we have had to offer you a place and then you can apply for the scholarships. We have a separate scholarship round. So really, I guess that the sooner you put up your information, the better. Then we have this 20-minute interview, and quite informally, I can offer you a place almost immediately. And then formally, things take a little bit longer through UCL centrally. So we try and keep things quite agile as a new business school and make decisions quite quickly. And then UCL sometimes takes a little bit longer to send through the formal offer.
Thank you.
So I know some people are part of trainee schemes and they need to tell their consultants in relation to rotas quite quickly before Christmas. So if you were to apply in the next few weeks, you should certainly know before the end of the year where you stand.
Perfect. Brilliant. Thank you.
Of the academic, the calendar year. Yeah.
Understandable. Thank you.
You're welcome. Okay, so I think that looks like it. So this is recorded. You're very welcome. GBSH YouTube has lots of recordings about what we do. Some of our guest speakers. So you can see our networks, and we have a very active Twitter and Instagram. So please do keep in touch. And thank you very much for your time today. So thank you.
Thank you.